Welcome back. November is National Prematurity Awareness Month, a month dedicated to raising awareness about premature births and reduce their rates in the U.S. Premature birth is defined as delivering before 37 weeks. It's the leading cause of newborn death globally and a significant unmet medical need. Here to talk to us more about it is Dr. Jabir, who is based in Naperville, and also Ashley Barkauskas, who had her first baby about 4 to 5 weeks early, right?
Yeah.
Thank you for joining us this morning.
Thank you.
First, let's talk about, I was so surprised when I heard that the number for premature births were going up. That startled me.
That's correct. The last 2 years, the number has gone up in the U.S.
And why do you think that is?
There's a variety of reasons. Could be socioeconomic factors, our failure to detect early or predict preterm delivery accurately.
And even here in Illinois, in the Chicago area, it's also a big problem that you're seeing, right?
Correct.
Tell me about that.
So in Illinois, we have received a C rating from the March of Dimes with regards to our preterm delivery rate. It is higher than the national average. Again, it's difficult to predict preterm delivery, which woman will have a preterm delivery. It's very difficult to predict. The only predictors that we have are a previous preterm delivery and also cervical length, but that fails to identify 85% of women who will deliver prematurely.
Okay, one of your patients is Ashley, and you have a 3-year-old named Brooklyn now, but you delivered prematurely.
I did.
What was that experience like?
It was very trying. It was probably the most difficult thing that I've gone through so far.
And you had no idea this was going to happen?
I had no idea. It just went into labor, and she was early and spent 11 days in the NICU, so it was difficult. So I think this would help a lot.
So there is a test that people can take to maybe learn if they are at risk. Tell me about that.
That's correct. The name of the test is preterm. It is a prenatal blood test that has been validated. It is drawn between in the 19th or 20th week of pregnancy. It is a sophisticated blood test that measures and analyzes certain proteins in the blood, and based on that, it gives a prediction of risk for preterm delivery.
Should everyone get this? Everyone who's pregnant? Or who needs this?
Everyone should be offered the test. Without it, there is essentially no other way to predict preterm delivery if patients do not have other risk factors.
Now, we've talked about how this is such a problem globally. What does it mean to the child and the mother when they do deliver early?
There's definitely risks to the baby for delivering early. Premature delivery is the highest risk of neonatal death in newborns. Also, there are risks of neurologic injury, as well as increased risk of infections, ADHD, and a variety of other disorders that newborns will have to deal with if they're born prematurely.
And Ashley, would you have gotten this test if you...
Absolutely. If it was offered, of course.
All right. Well, thank you for both of you joining us this morning and telling us about this, educating us. For more information, you can head to preterm, that's TRM.com, to find out more about this. And thank you, ladies, again, for taking the time to explain all this to us. Now let's go to Mark.